Good morning, I'm Jose Diaz-Balart, and our first focus, a morning of breaking news around Ebola. Before sunrise, emergency officials were knocking on the doors of this apartment complex in Dallas, alerting people that a fellow resident had tested positive for Ebola. This is the second person-to-person transmission of Ebola right here in the United States, and within the last 2 hours, officials of Dallas have warned more cases are a real possibility. They've confirmed the latest patient is a female healthcare worker who helped treat Thomas Eric Duncan before he died from Ebola at Texas Health Presbyterian Hospital 1 week ago. She is now in isolation, while 75 other hospital workers are being closely monitored. The Dallas mayor urged caution despite this morning's announcement.
While Dallas is anxious about this, and with this news this morning, the anxiety level goes up a level, we are not fearful.
Also at that news conference and joining me right now is Dallas County Judge Clay Jenkins. Judge, thank you so much for being with me. I know you've been up around the clock dealing with this crisis, wrapping up that news conference less than 2 hours ago. In your news conference, you said there's a real possibility that there will be more cases. What leads you to believe that?
Well, this breach, and that's a medical term of art, it's not saying anyone did anything wrong as far as the nurses, who I don't believe did anything wrong. I think they're heroic. It's either a procedure breach or a protocol breach, or perhaps a training breach, and that's a breach that can spread across many other workers. So we're looking to see what these two healthcare workers had in common in the way that they interacted with Mr. Duncan, and we'll probably announce some of those findings on the national call later today with Dr. Frieden. But it looks like now we could have a situation where the breach occurred as a procedure for many people.
You mentioned that
doesn't mean they got body fluid on them. It just means that they did it the same way these people did it.
Right. You mentioned that 75 other healthcare workers who treated Duncan are being closely monitored, but not quarantined. How are these patients being monitored?
They're being monitored by a CDC county team that's integrated, going and checking their temperature twice a day, and then they're checking their own temperature numerous times a day and looking for any symptoms that they might find. And they're healthcare workers, and they've been trained in what the symptoms of Ebola are. So actually turning the information in and getting into isolation, both Nina and patient 2, from the time they felt a symptom, were in the isolation within 90 minutes. So that part is working well, but clearly the part that happened at the time they were treating Thomas Duncan has exposed some of the healthcare workers to some real risk.
And Judge, I'm wondering if since Nina got this first and then this patient number 2 got it second, do you think there was a time difference between when they were treating Mr. Duncan? In other words, did one treat Mr. Duncan earlier and then the other one later in his process?
Well, they weren't on the same shift, so you know, a breach in protocol might be done 10 times, and on the 10th time it leads to an infection because you get some body fluid into a mucous membrane. One person might be infected on one day and another person on another day. Further, two people might show symptoms on different days because the latency period for this virus is anywhere from 2 to 21 days.
And Judge, are you confident that this situation is under control?
I'm confident that it's under control in this respect. I've got 75 healthcare workers that were getting into isolation the minute or as soon as they show symptoms. Therefore, there are very few contacts that they have if they become symptomatic, which is the only way you can catch Ebola. And the 48 people that were out in the community that we've been surveying and monitoring each day are at the tail end of their surveillance, and they're all asymptomatic and without fever. So it's bad news that another person is sick, but it's manageable. And if you didn't come into contact with the bodily fluids of Eric Duncan, you don't have Ebola.
Judge Clay Jenkins, I can't thank you enough for being with me this morning. I know you literally have not slept and you're working 24/7. I appreciate you taking the time to speak with me this morning. I appreciate it very much, sir.
Thank you.
NBC's Mark Potter is outside Texas Health Presbyterian, where there are, as you heard, now 2 patients in isolation being treated for Ebola. Mark, good morning. What can you tell us about this latest case?
Good morning, Jose. The judge you just talked to, Clay Jenkins, described this as a gut shot to the hospital community here at Texas Health Presbyterian. Very bad news for the hospital community. 77 people were involved in treating Thomas Eric Duncan. 2 of them have now presented symptoms. And of course, very worrisome, the possibility that there could be more, as he just said. What we know is that this healthcare worker is a woman. Who had worked on that team. She presented herself to the hospital yesterday complaining of a fever. Within 90 minutes, as the judge said, she was placed into isolation and tested. The positive results preliminarily came in late last night. They'll be confirmed by the CDC today. She lives in an apartment complex alone, we're told, with a dog. That apartment complex is about 3 miles from the hospital in northeast Dallas, in an area of a lot of apartment complexes. Early this morning, police and fire officials were out there knocking on doors, notifying neighbors of the situation. Reverse 911 calls went out to do the same thing. They're now in the process of cleaning the outside area of the apartment, the common area. We're told that the cleanup inside the apartment with a specialized crew will occur sometime this afternoon. Meantime, those 75 other workers are waiting to see if they present any symptoms. As you can imagine, it's a very anxious time here with the hospital community, and the hospital has said that isolation areas will be made available for those people who wish to wait out this time period away from their families to prevent the possible spread that way. So it's a very, very concerning time here. The only good news here right now today is that the 48 other people who are being monitored for contact with Thomas Eric Duncan, the original patient, before he went into the hospital, are all are asymptomatic, and they have passed that period where they're most likely to get sick. Their period will end over this testing period will end over the weekend, early into next week, and the chances of them getting sick now is said by doctors to be very slim. So that's good news for them. But the 75 others are now waiting, and I would imagine quite anxiously, Jose.
Yeah, sure. And Mark, how is the other Ebola patient, Nurse Nina Pham, doing at this hour?
Nina Pham has said that's some more good news, it sounds like. She is the 26-year-old nurse who was diagnosed over the weekend. She is said to be in good condition. She went from stable to good condition. She has been talking on the phone to her mother and to others. She's been Skyping. She also sent out a message yesterday saying that she is doing well. So the news is good there. And a lot of people have asked about her dog also. And the dog is being cared for by animal services here in an isolated area. The dog will be isolated for the 21-day period also to make sure that there's no problem there. As we know, a dog in Spain was killed. There was a lot of concern about that happening here. Officials say they don't plan to do that. They're just going to watch the dog and make sure that there are no problems. So in the case of Nina Pham, the news is pretty good, and people are taking comfort at least in that.
Yeah, NBC's Mark Potter, I appreciate your time. Thank you so much. And joining me now here in Miami is Dr. Eileen Marty, professor of infectious diseases at Florida International University. Dr. Marty recently returned from Africa, where she joined the fight against Ebola. Good to see you again.
Great to see you.
And Doctor, were you surprised that another Dallas nurse was infected with Ebola?
Once I saw the image of the Dallas Morning News showing how they were wearing the PPE, and I noted that there was exposed skin, I wasn't as surprised as I might otherwise have been.
Again, what is PPE?
Personal protective equipment.
So that's the entire gear. Now, they weren't wearing the entire gear, at least not initially.
Well, they were wearing whatever they were told to wear, and they were instructed however they were instructed. However, what I saw being worn would not have met the protocol standards that we were using in Africa.
Why is that? What do you think that is? I mean, why?
Well, I think that this is a whole new thing that the United States is dealing with at a community level. It's been well known within certain government centers, but it's not something that our community physicians and nurses and so forth are trained for. So I think what needs to happen now is that the Center for Disease Control needs to take the lead and go and create one standard that is at least as good and certainly can easily be better than what we do in Africa for all hospitals in the United States.
Yeah, right now, I mean, quite frankly, I'm asking you, and it's a general question, but right now, I presume that most, if not all, hospitals in the United States aren't really aware of just how extensive this protection needs to be, right? I mean, it's not something that anybody is trained on.
No, and there's so many things about this virus and about any infectious disease that is highly contagious like this that people need to be very aware of, that they're not just not used to dealing with it.
And what is this breach of protocol that the judge was talking about? What exactly does that mean?
That's a term of art, and really what they're saying is that there's a standard, there's an SOP, if you will, that people should follow, and whatever that SOP was, either it itself is inappropriate or it wasn't followed the way it was intended to be followed.
Showing some pictures of you in Africa, and that's what you've been here before, and you say that's the hello, the best way to do the hello, but these are pictures you've taken. You know, I really appreciate you being with me, Dr. Marty, and I know you'll be sticking around with me this hour because we have a lot to discuss and a lot to go over, but I really appreciate you being here. And are